video, we're going to start talking a little bit about headaches. So there's 3 different types of headaches. You have tension type headaches, and being very brief with these definitions, which feel like a band of tension wrapping around your head. Then you have migraine headaches, which tend to be the headaches that create sensitivity to light and have that feeling of nausea and vomiting that people tend to have triggers for. There's also a type of headache called cervicogenic headaches. Cervicogenic headaches tend to be side locked, which means that they are in one side of your head only. And a lot of times their origin can be some of the upper regions of your neck or tight musculature around your neck. So today Nick is going to be doing some releases with me for cervicogenic headaches. If you have any whiplash, concussion, anything like this, this is not in replacing seeing a therapist or a rehab specialist of any type. This is something to help you manage in between, or just to try and see if this is something that works for you. Okay, so we're going to use the peanut. There's a group of small muscles in the back called your suboccipitals. These muscles, which are innervated by the top 3 cervical spine nerves, can actually shoot pain into your head on one side or the other. So you're going to take the peanut, you're going to lie down on the ground, and you're going to place the lacrosse ball just underneath the skull bone. So you're going to come just behind the occiput and lie down on the lacrosse ball. Okay. He's going to lie down. If you get any symptoms of headache coming back or coming into the front of your head, you're going to ease off. Okay? So he's starting with his chin tucked. That's okay. You don't want to go into extension, but you can do a little tiny head nod through. Can you feel that?
Yeah.
Yeah. Is it referring into your head at all? No? Okay. So the tightness is okay, but as soon as it starts shooting, that's when you want to ease off the amount of pressure that you're placing on your neck. This is not supposed to be an aggressive release. This is not no pain, no gain. This is very gentle, and it's gradually trying to let the little tiny muscles underneath the base of the skull get them to relax. Once you've released through there for a couple of minutes, you can travel down the neck, come a little bit more into some of the paraspinal muscles, which are on either side. Good, can you do that?
Yeah.
So no pain face. This is your first time on the video, but no pain face. Okay, these are 2 releases. Another thing that can be very tight, especially when people are in a lot of stress, they tend to shrug their shoulders up, have a lot of tightness coming in through the traps. So another muscle that we can release is the upper fibers of traps. So he's going to come right here. Yep. This one is going to be a little bit more aggressive. It's probably going to be very sensitive and very painful, so just be careful. This is step 1 of this release. If he can just lie here, perfect. If it's too much, ease off. Otherwise, I'm going to get you to bend up your knees. And then you're going to bring your butt off. What this is doing is it's taking the weight of his body in towards the lacrosse ball, and it's making a more aggressive pressure. Okay, so this is step 2. This is okay. Then he's going to add his arm coming up over his head. Again, anytime you're having any headache, any shooting pain coming into the top of your head, you're going to stop, and then you're going to move up and down, and that's going to cause the glide in the muscle. So, cervicogenic headache, something that you can do possibly to manage it, other than thinking about your posture, making sure you're not jetting your neck out, keeping it nice and in line, is doing some gentle release and massage work through the top, just underneath the skull, coming down through the neck and into the upper fibers. These are step 3s.